Some mornings, your knees feel stiff as a board. Even after a peaceful night's sleep, as soon as your feet hit the floor, a sharp pain shoots up, making you freeze for a few seconds. Those first few steps become slow and heavy, like carrying an extra burden on both knees. The silent battle of aging joints. No one is surprised. Joint pain is all too common after age 60. But what's frightening is, the pain doesn't just come with movement. Even when you're resting, it can be a dull ache, a persistent throb, a nagging reminder that you're not what you used to be. You start to worry. Will there come a time when I can't walk on my own, when I can't climb the steps to my front door anymore? This fear is actually well-founded. Arthritis isn't just pain, it's a silent process that destroys cartilage, causes deformities, and gradually leads to loss of joint function, if not managed properly. But conversely, those who know how to care for their bodies correctly from an early age can maintain mobility throughout old age and sometimes even be healthier than younger people. The question is, what does correct care mean? Many people are doing one important thing wrong. They only fight the pain, neglecting its root cause, which is chronic inflammation and silent joint degeneration. They take painkillers whenever they ache, but pay no attention to their daily eating habits. Meanwhile, according to numerous studies from Harvard, Mayo Clinic, and the Arthritis Foundation, nutrition plays an essential role in slowing down joint degeneration, even helping to restore some damage in early stages. Certain foods contain natural active compounds that can reduce inflammation, protect cartilage, support joint blood circulation, and reduce oxidative reactions, comparable to mild anti-inflammatory drugs, but without side effects like stomach upset or liver damage. The important thing is to know which ones actually work, have been scientifically proven, and how to use them correctly to achieve benefits without adverse effects. And that's what's about to be presented, a journey to discover the friends of your joints, silent, natural, but with astonishing power. Do you want to turn your daily meals into a joint healing remedy without needing to visit a pharmacy? If so, let's start in the next section. Let's start with one of the most impressively powerful foods for soothing joint pain. That's cold water fatty fish, like salmon, mackerel, or sardines. This is food number one on the list for natural pain relief for people with arthritis. And it's interesting that many people eat this fish simply because it tastes good without knowing its silent healing effects on protesting joints. These fish are particularly rich in omega-3s, with EPA and DHA as the two main components, acting like firefighters in the body. When a joint is inflamed, the tissues around the joint, especially the synovial membrane, start to release inflammatory mediators like PGE2 or LTB4, causing the joint area to become swollen, red, hot, and even sharply painful with movement. This is when EPA and DHA take effect. They not only inhibit the production of these inflammatory substances, but also reduce the activity of an important gene called NF-κB, which is the master switch, controlling the entire inflammatory system in the body. This mechanism has been clearly demonstrated through numerous studies. In a meta-analysis of 4 controlled clinical trials published in 2019, researchers found that eating at least 2 servings of fatty fish per week helped reduce pain by approximately 30% on the VAS scale in people with rheumatoid arthritis, a very notable result comparable to the efficacy of many common painkillers but with fewer side effects. Regarding consumption, experts often recommend that people aged 60 and older should include 2 to 3 servings of fatty fish per week, with each serving being about 3 ounces, 85 grams, which is just a piece of fish smaller than your palm. Steamed salmon, grilled mackerel, or canned sardines eaten with whole grain bread are all easy options. For those who cook less, fish oil supplements can be used, prioritizing varieties containing a total of about 1 gram of EPA and DHA daily, and it's best to take them immediately after a meal to avoid bloating or fishy burps. Banana saltin. However, a few important points need to be remembered. Omega-3s, though beneficial, can mildly thin the blood, so those using anticoagulants like warfarin or high-dose aspirin need to consult their doctor before taking large doses of omega-3s. Additionally, if you frequently experience acid reflux or have a sensitive stomach, you should choose odorless fish oil capsules, enteric-coated varieties, or divide the daily dose into smaller servings. Another small tip: if you dislike the fishy smell, try marinating salmon with ginger, garlic, and lemon juice before grilling. This not only eliminates the odor, but also increases nutrient absorption thanks to the bioactive compounds in these spices. Some older adults are even more creative, mixing sardines with mashed avocado, adding a little black pepper, and spreading it on whole grain bread for a delicious and joint-friendly snack. Perhaps ultimately what matters isn't just knowing which foods are good, but also the perseverance to consume them regularly. Because the benefits of fatty fish don't come overnight. It takes at least 4 to 6 weeks of consistent use for you to truly feel your knees becoming less stiff, your mornings no longer requiring a long warm-up, and those dull aches beginning to recede. Do you remember the last time you ate fish? If it's been a while, today might be a new beginning. Because with just the right kind of fish, prepared the right way, you've laid the first brick in rebuilding flexibility for your own joints. And if you're thinking, are there other foods that are just as effective but easier to incorporate into daily meals? Then don't look away, because the next food might already be in your kitchen, each shimmering golden drop with anti-inflammatory effects similar to ibuprofen, but from pure nature. If fatty fish is the silent firefighter for inflamed joints, then food number 2, extra virgin olive oil, is the steady companion, helping to gently and effectively reduce inflammation day by day. What's special is that this oil is often already in many American households' kitchens, but its potential to relieve pain, like medicine, hasn't been fully utilized. Extra virgin olive oil, especially the first cold-pressed type, contains a very special active compound called oleocanthal. The name might sound unfamiliar, but its effect is very familiar. Oleocanthal has a mechanism similar to ibuprofen, a common non-steroidal anti-inflammatory drug used to treat joint pain. Specifically, this substance helps inhibit COX-1 and COX-2 enzymes, the enzymes responsible for synthesizing inflammation and pain-causing prostaglandins. When the activity of COX-1 and COX-2 decreases, the amount of inflammatory substances also decreases, thereby reducing joint swelling, heat, and pain during movement. In addition to oleocanthal, olive oil also provides hydroxytyrosol polyphenols, a powerful antioxidant that helps protect joint cartilage from free radical damage, especially useful in older adults, where the endogenous antioxidant system has begun to weaken over time. All of this isn't just theory. A clinical study showed that people with knee osteoarthritis who used about 1.7 philos OZ, 50 ml, of extra virgin olive oil daily for 12 weeks reduced their CRP, a biomarker for systemic inflammation, by 22% and improved their WOMAC scores, especially in terms of pain and walking ability. What's remarkable is that these results were achieved without needing additional pain medication, simply by changing daily oil consumption habits. So, how do you easily and correctly incorporate olive oil into your diet? It's very simple. Start replacing animal fats with extra virgin olive oil in light stir-fries, or use it for salads, marinating food, or dipping whole grain bread. The recommended amount is about 2 to 3 tablespoons, 30-45 milliliters per day. If you find it hard to measure, remember this tip. 1 tablespoon is about 0.5 floors Aussie, 15 milliliters, equivalent to a small circle of oil, just enough to cover the bottom of a salad plate. However, one thing to note, extra virgin olive oil is not suitable for high temperature frying, as this will reduce the activity of its valuable polyphenols. Prioritize using it at low temperatures or add it after cooking, and don't confuse extra virgin olive oil with refined olive oils on the market, which have been heat processed and lost most of their benefits. Another point, since olive oil also has high caloric value, those managing their weight should not overuse it. Balancing the amount of oil with servings of green vegetables and whole grains is the optimal way to both reduce joint pain and maintain a healthy physique after age 60. If you once thought only medicine can relieve joint pain, perhaps today the small bottle of oil in your kitchen will make you reconsider, because from each quiet drop, olive oil is silently helping you reduce inflammation day by day, joint by joint, in a sustainable and natural way. And now, imagine, what if there was a food whose color and mild spiciness carried the essence of the East, yet had effects as powerful as a non-steroidal anti-inflammatory drug? Let's explore food number 3, the radiant golden spice that's essential in an anti-inflammatory kitchen. If fatty fish is the silent healer for inflamed joints and extra virgin olive oil is the steady companion, then food number 3, turmeric, curcumin, is nature's golden warrior, silently blocking pain at its root. Isn't it strange, a simple spice from an Asian kitchen, yet hailed as the most powerful natural anti-inflammatory ever studied? The key lies in curcumin, the main active compound that gives turmeric its shimmering golden color. But beyond its beauty, curcumin has a strong ability to inhibit inflammatory molecules like TNF-alpha and interleukin-6, which are the culprits behind persistent pain and morning joint stiffness. Additionally, curcumin suppresses the activity of the enzyme MMP13, an enzyme involved in the destruction of joint cartilage, something all osteoarthritis patients face. What's even more special, curcumin not only extinguishes the fire of inflammation, but also protects cartilage cells from degeneration, helping to prolong joint lifespan and delay the process of cartilage wear and tear with age. This is why scientists call curcumin a gentle immunomodulating agent. It doesn't suppress the entire immune system like strong drugs, but intelligently and selectively soothes the inflammatory response. Beyond its mechanism, the practical effectiveness of curcumin has been clearly demonstrated. A randomized controlled clinical trial, RCT, tested 1 gram of curcumin combined with 10 milligrams of piperine from black pepper daily for 8 weeks in people with knee osteoarthritis. The results were impressive. The group taking curcumin showed a 47% reduction in pain and joint stiffness according to the WOMAC scale, almost equivalent to the effectiveness of diclofenac, a common strong pain reliever. This shows that curcumin is comparable to medication, but safer, especially for older adults prone to stomach irritation. So how do you use curcumin effectively? There are 2 common and easy options. Traditional method, 1/2 to 1 teaspoon of pure turmeric powder, cooked with a little coconut oil or olive oil to increase absorption, and a pinch of black pepper to increase bioavailability by 20 to 30 times. You can use this when cooking curries, stews, or add it to plant-based milk in the evening to make a warm, golden milk. Modern method. Use standardized curcumin capsules, BCM 95, Mariva, or Longvida. These are enhanced forms for easier absorption by the body. The recommended dosage is 500 milliliters to 1 gram per day, divided into 2 doses after meals. However, even though it's a natural food, curcumin should not be consumed in amounts exceeding 2 grams per day, especially if you are taking anticoagulants like warfarin, high-dose aspirin, or are about to undergo surgery, because curcumin can mildly thin the blood and increase the risk of bleeding. Additionally, those with gallstones or severe stomach ulcers should consult their doctor before long-term use. Now, a quick question. In your kitchen, is that jar of turmeric powder lying dormant in the back of the cupboard? If so, perhaps now is the time to wake it up and incorporate it into your daily joint recovery journey. No high doses needed, no complicated medicines, just a little golden shimmer in your daily meals, and you might find your joints less swollen, less painful, and more flexible over time. And if you're wondering, is there something lighter than turmeric but still a powerful natural anti-inflammatory warrior? Then get ready for food number 4, a warming spice you can easily find in any US supermarket, from Walmart to Whole Foods. The latest research is showing it deserves to be called a natural pain reliever for knee joints. Ready? We'll meet again in the next section with a spice that's pungent yet gentle, hot yet healing, ginger. If you've ever sat in bed some morning, gently rubbing your knee, trying to bend it, and your joint felt like it hadn't woken up yet, then you'll probably understand why ginger is so frequently mentioned in traditional medicine and modern research. It's not just a simple warming spice for food. Ginger, with its seemingly humble small slices, possesses a clear anti-inflammatory power, especially for joints that are stiff, inflamed, or achy with the weather. Mechanistically, ginger acts as a natural inhibitor of inflammatory enzymes. The two main compounds in ginger, gingerol and shogaol, can inhibit COX-2 and 5-LOX enzymes, which promote the formation of prostaglandins and leukotrienes, inflammatory mediators. By inhibiting these enzymes, ginger helps block part of the inflammatory reaction chain within the joint. Additionally, it has an antioxidant effect, a factor that contributes to cartilage cell damage over time. What makes ginger a proven choice isn't just theory. A randomized controlled trial, RCT, involving people over 60 with knee osteoarthritis, one of the groups most clearly affected by chronic inflammatory complications, was conducted. After 12 weeks of using 1.5 g of ginger powder daily, the intervention group showed a 25% reduction in pain, while the duration of morning joint stiffness also significantly shortened compared to the control group. This is not a small result, because morning joint stiffness is one of the reasons many older adults are reluctant to leave bed or struggle to start their day comfortably. So how can you use ginger to get its benefits without taking pills or supplements? A very simple way is to make warm ginger tea every morning, just 2 to 3 slices of fresh ginger steeped in hot water for about 8 to 10 minutes. You can add a little honey if you prefer a mild sweetness. If you want more flexibility, you can also sprinkle a pinch of dried ginger powder into your oatmeal or blend it into a smoothie if you're used to its distinctive aroma. Some people even use finely chopped fresh ginger stir-fried with vegetables or in evening soups. It aids digestion, supports joints, and is easy to prepare. However, ginger isn't for everyone. Those with stomach ulcers, acid reflux, or who are taking blood-thinning medications like warfarin should be cautious. Although ginger is generally safe, high doses for a long time can increase the risk of minor bleeding or cause stomach upset if consumed on an empty stomach. Ideally, combine ginger with meals or use it in the morning with a light snack. Now think about it. Have you ever felt your knee joints creak every time you get out of bed? Have you ever felt prolonged cold weather make you reluctant to move because your joints felt like they were frozen? If the answer is yes, perhaps you've also wondered, is there anything simple, easy to find, and warm that can help support your joints every day? Ginger, a familiar spice found in almost every home, is one of the simplest and most effective answers. And if you think only spicy things create a warming sensation, the next section will bring you another surprise, a deep red, mildly tart fruit that is being researched as a natural medicine to soothe joints, reduce inflammation, and significantly improve inflammatory blood markers. Can you guess what it is? Let's explore food number 5, a natural juice that is surprising even nutrition researchers, tart cherry. Here's a surprising truth. It's not just spicy foods or warm drinks that can relieve joint pain. Sometimes a mildly tart and colorful juice can deliver powerful anti-inflammatory effects comparable to a mild anti-inflammatory drug. And that's why tart cherry juice, also known as sour cherry juice, is gradually becoming a familiar name in research on knee osteoarthritis and cartilage degeneration in older adults. Unlike the sweet cherries commonly found in supermarkets, tart cherries are more sour, have less natural sugar, and notably have a much higher concentration of anthocyanins, powerful antioxidant compounds. Scientists have identified that anthocyanins, particularly cyanidin-3-glucoside, can directly inhibit COX-1 and COX-2 enzymes, the two enzymes that produce inflammation-causing prostaglandins in the joints. Additionally, these compounds also reduce uric acid in the blood, scavenge free radicals, and reduce oxidative stress in the joint fluid environment, thereby helping to reduce swelling, alleviate pain, and slow down cartilage degeneration. Does this really work in real life? A prominent RCT study was conducted on women aged 55 and older with knee osteoarthritis. After 6 weeks of consuming 8 flowers, 240 ml of pure tart cherry juice twice daily, the results showed CRP, C-reactive protein levels, a biomarker reflecting systemic inflammation, decreased by an average of 23%. The WOMAC score, a scale assessing knee pain and function, decreased by 20%, indicating significant improvement in both pain levels and mobility. A glass of juice, consumed regularly every day, that can provide such clear benefits is truly a solution worth considering, especially for those seeking a gentle, supportive method that doesn't affect the stomach or digestive system like some long-term anti-inflammatory medications. To apply this, the simplest way is to consume 4 to 8 flowers, 120 240 ml of pure tart cherry juice, divided into 1 to 2 times a day, ideally after breakfast or dinner. If you're not used to the natural tartness, you can dilute it with water or combine it with a few slices of fresh ginger to enhance its anti-inflammatory effects and improve blood circulation. Remember to choose products with no added sugar and from reputable sources, as some ready-made products may contain high sugar levels, which are not suitable for those managing blood sugar. However, even though it's natural and generally safe, tart cherry still has a few points to note. People with type 2 diabetes or those taking blood sugar controlling medications should start with a low amount, about 3.4 flowers, 100 ml per serving, and monitor their blood sugar after consumption. Additionally, because tart cherry has a uric acid lowering effect, if you are taking medication for gout, discuss this with your doctor beforehand to adjust the dosage appropriately. Now think about it. Have you ever sat looking at the stairs in your house, contemplating going down them, but your knees felt like they were protesting? Or have you ever walked in the park on a day when every step brought a light, needle-like pain? Those pains don't necessarily have to be endured. Sometimes the solution lies in a small glass, full of vibrant red, mildly tart and beneficial tart cherry. And if you're looking for a solution that not only fights inflammation, but can also slow down the destruction of joint cartilage at its root, the next food will surprise you. It's not a medication, nor is it a juice, but a familiar green vegetable, often underestimated, yet now being shown to protect joint cartilage and activate endogenous antioxidant enzymes. Can you guess which vegetable it is? Let's explore food number 6, a seemingly ordinary vegetable that is actually a true cartilage protector: broccoli. In daily life, some foods are so common that people forget their true value. And broccoli, a vegetable that many older adults in the US often see as a side dish on their diet plate, is actually being researched as a biological shield protecting knee joints from the silent devastation of chronic inflammation and cartilage degeneration. What makes this vegetable so special? The answer lies in sulforaphane, a natural bioactive sulfur compound that forms when you chew, chop, steam, or lightly cook cruciferous vegetables like broccoli. Sulforaphane can activate the transcription factor NRF2, which is considered the master switch of the body's endogenous antioxidant defense system. When NRF2 is activated, a series of protective enzymes like glutathione peroxidase, catalase, and SOD are produced in greater quantities, helping to neutralize free radicals, reduce oxidative stress in cartilage tissue, and slow down the chronic inflammatory process that leads to degeneration. Even more, sulforaphane has also been shown to inhibit ADAMTS5, an enzyme that breaks down aggrecan, a key component of the cartilage cushion in knee joints. By reducing ADAMTS5 activity, sulforaphane not only prevents destruction but also protects the cartilage layer that gradually wears down with age. That's the biological foundation, but is there clear real-world evidence? The answer is yes. A preliminary clinical study was conducted on middle-aged and older adults at risk of osteoarthritis. After 12 weeks of supplementing with boiled broccoli, about 8.8 250 grams per day, the results showed TOMP, cartilage oligomeric matrix protein levels, a biomarker reflecting cartilage degradation, decreased by an average of 15%, an indicator showing real effectiveness in protecting knee joints. Additionally, those who regularly consumed broccoli also reported improved joint stiffness and a feeling of easier movement when getting out of bed in the morning, a very noticeable benefit for those over 60. So how should broccoli be prepared to optimize the effects of sulforaphane? The secret lies in proper cooking. Sulforaphane only forms when the enzyme myrosinase is active, and this enzyme is destroyed at excessively high temperatures. Therefore, instead of boiling thoroughly or stir-frying for too long, you should lightly steam broccoli for 2 to 3 minutes until it turns a deep emerald green but is still crisp. Another tip is to eat it with fresh broccoli sprouts. Just 1 ounce, or 30 g, of sprouts daily provides significantly higher amounts of sulforaphane than mature vegetables. You can serve steamed broccoli with boiled eggs for breakfast, add it to vegetable soup for lunch, or blend it with avocado and walnuts to make a dip for an afternoon snack. If you're not used to its slightly pungent taste, try drizzling some extra virgin olive oil and a few drops of lemon juice. This method is both delicious and enhances the absorption of anti-inflammatory compounds. However, there are still a few points to note. Since broccoli contains a fairly high amount of vitamin K, those taking anticoagulants like warfarin should maintain a consistent daily intake and inform their doctor if their diet changes. Additionally, people with irritable bowel syndrome, IBS, or who are prone to bloating can start with small amounts to monitor their digestive reaction. Do you remember how your knees started to groan after just a 10-minute walk, as if the cushioning inside had thinned with each passing year? Or those winter mornings when just bending down to tie your shoes made your hip joints feel a bit stiff and your back slightly creaky? If you're used to enduring that feeling, perhaps it's time to give your knees another chance with simple yet effective vegetables like broccoli. And if you're looking for another delicious, convenient, easy-to-eat option that also contains extremely powerful anti-inflammatory compounds, the next food will make you feel like you've stepped into a summer fruit garden. Not pungent like ginger, not thick like turmeric, but full of color, easy to digest, and rich in joint-protecting compounds. That's food number 7, berries, the berries you commonly see in supermarkets. From blueberries to strawberries, from raspberries to blackberries. You don't need to be a doctor or a nutritionist to realize fruits with deep purple, blue, and red colors like blueberries, strawberries, raspberries always appear in health advice. But not everyone knows that they can soothe joint inflammation, not just thanks to their abundant vitamins, but precisely because of a group of natural active compounds called anthocyanins, the substances that create their vibrant colors and also powerful and safe anti-inflammatory agents for older adults. Your body may be experiencing lingering inflammation in your joints, like your fingers, knees, or ankles, where free radicals are constantly produced and attack the synovial membrane and fragile cartilage cells. Anthocyanins in berries act as scavengers, cleaning up free radicals, soothing inflammatory responses, and limiting damage to joint tissues. Additionally, quercetin, a flavonoid also common in strawberries and raspberries, also helps reduce levels of IL-6 and other inflammatory cytokines, which are leading culprits causing morning joint stiffness and pain during movement. But this isn't yet convincing enough without clear scientific evidence. A clinical study was conducted on older women with knee osteoarthritis. For 4 months, they were supplemented with 1.8 OSE, 50 grams, of freeze-dried blueberry powder daily, equivalent to about 1 cup of fresh fruit. The results? Compared to the control group, the blueberry group reported a significant reduction in morning joint stiffness and an increased ability to walk further without pain, a practical, easily noticeable improvement for those suffering from daily joint pain. Another study also showed that anthocyanins in berries can reduce COX-1 and COX-2 activity, similar to the mechanism of ibuprofen, but without causing stomach irritation. This is a significant advantage for older adults who are often sensitive to NSAIDs. So how can you fully utilize the power of this fruit group? Ideally, you can eat 1 cup, about 5.3 Oz or 150 Gs, of fresh blueberries, strawberries, or raspberries daily. If fresh fruit is hard to find or you want a more convenient option, You can substitute with 2 scoops of freeze-dried powder mixed into a smoothie, or make overnight oats with oatmeal, almond milk, and a handful of dried berries. However, a note: avoid adding sugar to berry dishes, as refined sugar can stimulate inflammation and counteract the benefits. Additionally, those managing blood sugar should monitor their glucose response after eating, especially when consuming concentrated juices or smoothies. From a simple slice of salmon to a refreshing glass of tart cherry, or just a little ginger in your morning tea, each small choice, if repeated daily, can make a big difference for the joints of people over 60. The journey to relieve joint pain doesn't need to start with complex prescriptions. It can come from 7 scientifically proven foods, delivering real benefits when used correctly, consistently, and persistently. We've explored cold water fatty fish like salmon and mackerel, sources of EPA and DHA that help extinguish inflammation at its root in the synovial membrane. Extra virgin olive oil, dubbed natural ibuprofen, not only reduces inflammatory markers, but also improves knee joint flexibility. Golden turmeric, its curcumin content matches the pain-relieving effects of diclofenac, but is safer and can be used long-term. Ginger, a familiar spice that is also a powerful anti-inflammatory, improving knee pain and morning joint stiffness. A glass of tart cherry juice helps cleanse joint fluid, reduce urate, and fight free radicals, especially beneficial for those with osteoarthritis. A plate of broccoli or a small handful of broccoli sprouts, something thought to only help prevent cancer, is now also protecting precious joint cartilage. And finally, berries like blueberries. Not just beautiful, but also a purple medicine that fights inflammation and increases mobility for older adults. All these foods are not meant to be eaten at once, but are a pocket toolkit for you to rotate, combine, and create a proactive, effective, and joint-friendly diet as you age. Sometimes, the power to fight joint pain isn't in expensive prescriptions, but in your very own pan, bowl, or daily glass. A simple meal with some fish, a few drops of olive oil, the golden hue of turmeric, or the purple of berries is a gentle reminder that the body still has the ability to heal itself if we give it the right ingredients. If you've tried any of these foods, share your experience in the comments below. Who knows, your story might motivate someone else to start. And if you find this list helpful, don't forget to like and subscribe to the channel, because many more natural, easy-to-apply methods are waiting to be revealed to protect your feet, hands, and quality of life for those over 60.